Okay. Uh, can we share some information on menopause, which is experienced by the mid-age woman?
Yeah. So menopause is a whole big chapter. We had a book written by one of our teachers, Dr. Usha Krishna,
Okay.
on menopause. The ovaries, as I said, have the function of producing the eggs and secrete the estrogen hormones.
Okay.
But the follicles are limited, and by the age of 48 or 50, they deplete,
Okay.
and the estrogen hormone depletes. It's the main feminine hormone. So, when the estrogen hormone depletes, the menses ceases to occur, and if the woman does not get menses after 1 year, it is called menopause.
Okay.
Why it is important? Estrogen is the prime mover of the woman. It is present in all different parts of the body, in the skin, in the vagina, and also in the bones.
Okay.
So a stage of estrogen depletion can cause symptoms. Mainly the woman can feel very hot. It is called hot flushes. They can have sweating.
Right.
They can have wrinkling of skin, hair loss.
Right.
They can have vaginal dryness, itching in the vagina. They can have symptoms of passing urine while coughing. If the vaginal support system is reduced, the whole organs, if they have had a normal delivery, the organs can come out. It is called prolapse uterus.
Okay.
So they can have difficulty in having intimate contact with their partner because of the dryness. So these symptoms can be taken care of. The other long-term implications are the estrogen hormone protects women from cardiac problems
Okay.
and cerebrovascular problems like stroke.
Okay.
So we see typically the woman gets the ischemic heart disease or angina, that is pain in the chest, or myocardial infarction or paralysis 10 years later.
Okay.
Men get it between the age of typically 45 to 55. Women get it from 55 to 65.
Okay.
The bones also become more fragile after the menses stop. It is called osteoporosis. There is a stage, osteopenia and then osteoporosis. The bone undergoes a constant modeling and remodeling cycle, and it requires calcium and vitamin D. So there is something called osteoblast which forms the bone, and osteoclast which destroys the bone. After menopause, the osteoclast activity increases and the bone resorption, that is the absorption of bone tissue, becomes faster. And what we say, the bone becomes very hollow and brittle. So the woman is prone to fractures fast.
Okay.
In this occur in the vertebral column, they get this hump, which we know Manthara of Ramayana fame had that hump.
Right.
If they have weakness of the main thigh bone, which is a weight-bearing bone, and they slip because of this nowadays porcelain tiles or something, they get the fracture of the neck of the femur, which is connecting the appendicular skeleton to the axial skeleton. Or they fall and they take a support of the hand, the wrist fracture occurs. To prevent all this, one has to counsel. We do certain tests. We do a mammography to see whether the woman is having any lump in the breast. And then, if all the tests are normal, we can suggest them a hormone therapy, replacement therapy. If the uterus has been removed, we have to just give only estrogen supplementation. If the uterus is intact, this unopposed estrogen can cause the hyperplasia, which I had mentioned earlier, and malignancy.
Okay.
So we have to support that with progesterone.
Okay.
Very rarely, it also can cause breast cancers. But then, if the woman is having a history of breast cancer, we give a separate hormone for hormone replacement. And if something new occurs, so that is why we advise this woman self-examination of breast. Ideally, every woman above the age of 40 should undergo self-examination of breast and mammography at least once in 5 years after age of 40.
Okay.
Mammography is a soft tissue X-ray of breast. It denotes a early detection of any breast lump, and sometimes that breast lump can be malignant type. So we take a biopsy, and if it is there, then a cancer breast can be treated much better if it diagnosed very early.
Okay. Sure.
So other things in menopause supplementation is basically diet rich in calcium. We give calcium supplements, vitamin D supplements. we give something called alendronate, that is zolandric acid, that is it reduces the activity of osteoclast, which I said, and it helps in bone reforming.
Okay.
But the most important thing in this age group is psychological problems. At this point, the woman who is the main mover, everybody knows the Jawaharlal Nehru statement, if the nation has to be awakened, it is the woman who has to be educated. When she moves, the family moves, the village moves, and the country moves. It was a very famous statement that time. And our Prime Minister Modi has a lot of importance to women education and women empowerment, which is very good. So at this particular time, the woman has given all her life for the family. The children have grown up. They have gone to study. Nowadays, a lot of people are going abroad to study. Husband is still doing his job or what is his business. And then they feel these hormones are depleting and they get something like an emptiness syndrome.
Right.
So then they should have a group. They should have develop a hobby. They should talk with each other. I remember my mother, she's an anesthetist. They have a group of doctors. They meet every month and they share and they have developed new hobbies.
Right.
So that way they keep occupied. Otherwise, depression is very common in this age group. So that also has to be taken care of and we have to speak out.
Right.
That is very important.
Sure.